membership, concierge-like membership model accomplishes a few things. The first is time. As you know, a lot of the Medicare Advantage programs and a lot of these HMOs, it's really about seeing you for 10 minutes. You're very likely going to get a bunch of tests you may or may have not needed, and a bunch of referrals to several different consultants because they just don't have enough time to spend for you. So that typically leads to delays in care, poor coordination, and likely you'll end up at my original office in the ER in Long Beach with 100 other people in a really small waiting room. So that is the current product, whether it's, and I don't mean to downplay what Optum does or what Memorial Care does or what any other private practice physician is, but that's just they're practicing in the current system that exists. So in order for physicians to sort of empower them to practice true, legitimate, proven, evidence-based medicine, they need time, and for that they're starting to create this membership model. Dr. Sotelo did fill her panel recently, like as of a couple weeks ago. So we did hire a new physician, Dr. Jasia Hu, who's on the picture there. She's been working with Dr. Sotelo for 15 years. So they just keep following each other around from clinic to clinic, and she's ready to do the change. She's incredibly excited. I've known them since they were training. I meet their patients in the ER, and they're very good physicians, and that's the type of physician base we're growing. So we're adding a third doctor hopefully in the next 6 months as well, as there's a huge demand. And just kind of to add a little bit of what Michelle was, when you're thinking about planning and aging, it does start with the physician, but there's one of the important things when you do see your primary care doctor is there's the mental health aspect, the physical well-being aspect, as well as your bread and butter cholesterol, diabetes, weight management, and that all really gets accomplished through a membership care model. That again, at the end of the day, it's about prioritizing the care of just about anyone. As we all age, decade after decade, we do start building up more issues that we need to address. You definitely need to pay attention to more things that could occur in terms of what goes on that you can't feel, whether it's blood pressure, your risk of a heart attack, your risk of kidney disease. So we are a resource that's going to grow here, the combination of New Cadence Healthcare and Continuum, and the whole purpose is to really provide full service wraparound primary care and emergency services to try to avoid ever landing in a hospital, and that's really, it's a proactive approach to healthcare. So.